Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the biomechanics of wrist and hand complex. So first is the introduction. The hand consists of 5 digits, that is one thumb and 4 fingers. There are 8 carpal bones, and in hand complex there are 19 bones and 19 joints distal to carpal bones, and each digit has a carpometacarpal joint CMC and a metacarpophalangeal joint, that is MCP. Each finger has 2 interphalangeal joints, one distal DIP and one proximal PIP, except thumb having only one interphalangeal joint. The wrist complex. So the wrist or carpus consists of a 2 compound joint, the radiocarpal and midcarpal joint, referred to collectively as the wrist complex. The major contribution of the wrist complex seems to be control length tension relationships in multi-articular hand muscles and to allow fine adjustment of the grip. The wrist muscles appear to be designed for balance and control rather than for maximizing torque production. Next, the wrist or the carpus consists of 2 joints, radiocarpal and midcarpal joint. Now the basic anatomy of the wrist joint. Wrist joint is a synovial joint of the ellipsoid variety between lower end of radius and 3 lateral bones of proximal row of carpus. Articular surface are in upper inferior surface of the lower end of the radius and articular disc of the inferior radioulnar joint, and in lower scaphoid, lunate and triquetrum bones of carpal. So this is the structure of the radiocarpal joint, in which the scaphoid, lunate and triquetrum are involved and the radius, and articular disc is present in the joint cavity. So proximal and distal segment of the radiocarpal joint. Distal radius has a single continuous bioconcave curvature that is long and shallow side to side and sharper and shorter anterior posteriorly. Proximal joint surface consists of lateral radial facet, that is scaphoid, medial radial facet, that is lunate, TFC triangle fibrocartilage complex. Proximal radioulnar joint surface is oblique and angles slightly wordly and ulnarly. Average inclination of the radius is 23 degree and tilted 11 degree volarly. Thank you.